everybody, welcome back. This is your friendly neighborhood plastic surgeon, Dr.Surindher. So today I'm trying to touch upon another topic which we get many queries from, is what exactly is blepharoplasty and who needs it. So blepharoplasty by definition actually is a correction of the eyelids, which is basically could be the upper eyelid or could be the lower eyelid. And so what are the changes that happen and when do you need a blepharoplasty? So in the upper eyelid, the most common thing that happens with aging in all the body is that your skin is sagging, you're losing volume, you're losing body fat, and that is why as you age, your face tends to droop. So now there are two aspects to it. So let's talk about the upper eyelid first. So in the upper eyelid, what the main issue that you see is a hooding of the eyelids. So there is a fold of skin which comes, and sometimes it can cover the eyelid, so it can be difficult in opening and it can affect your vision also. The second is hooded eyebrows. Sometimes the eyebrows are also dropping because the forehead is dropping, so that also causes a hooding, and that doesn't allow your eyes to open up fully, and when you're looking in the sides you can actually see the hoods. So for the upper eyelids, you have to decide whether it is a hooding of the eyebrows, in which case you need a brow lift, or where you have to lift the eyebrows away from the eyes, or whether you have actual excess skin on the eyelids which needs to be removed. So if you have a hooded eyebrows, then you can either do a brow lift or you can do a thread lift to lift the brows. If you have eyelids which are hooded and you have excess skin there, then you go in and do a blepharoplasty. As far as the under eyes are concerned, most commonly when they come in, they ask for hollowness under the eyes or eye bags. Typically in patients who from the Southeast Asian or the Asian countries, we have a little thicker skin, so we don't have too much of skin excess, and there is more hollowing of the eyes, which is commonly, we are seeing it quite early nowadays, which is called the tear trough. And the second is where you have fully bulging eyelids, and where there is the fat which is bulging out and there is a lot of excess skin, and you can see fine wrinkles, and you can see actually a lot of excess skin when you pull your eyes out like this. So for them you need a blepharoplasty. So what do you do when you have hollowness? So hollowness under the eyes is now a very common problem, and we see it as early as even in the late 20s or in the early 30s. So that is because of lifestyle changes and also aging process which has started. So you're losing fat. So that is what gives the depression there, and which is typically called the tear trough. The tear trough is what causes the depression, and that is because of volume loss. It is not because of excess skin, it is not because of loose skin. So it's an early form. In the more advanced stages, what happens is there is hollowness and there is weakening of the ligaments, because of which the fat is bulging out. And of course, you have loose skin as well under the eyes. An upper blepharoplasty is typically a simpler procedure because it is done under local anesthesia, and you just have to tighten the muscle as well as the skin on the upper eyelid. It can be done under local anesthesia, and we take out a small sliver of skin and then we re-stitch the whole thing up, and typically you're back to your normal activities the next day, but you have a little bit of swelling and bruising, so that usually takes about a week. The lower eye blepharoplasty is a more complex procedure and it's usually done in anesthesia, because we have to actually go in, and if there is a lot of skin excess, then we go in from the skin side where we remove the skin, we re-drape the fat. We don't remove the fat anymore, we re-drape the fat to fill in the hollows which are already there, and then we redrape the skin on top of it and remove the excess skin. So that gives you a nice youthful lower eyelid, and it also supports the lower part of the eyelid and gives you a much better contour here. In early stages, when there is more of hollowing and there is not too much of excess skin, or in patients where there is not too much of excess skin, we go in through a cut inside the eyelid. And what we do there is we're going in through the eyelid, and because we're not removing the skin, what we do is we mainly address the fat pads, which are then covered onto it, and then we redrape the skin on top of it, so that helps with the hollowing.
No, if the hooded eyebrows are because of a drop in the brow, then that is not going to be corrected with an upper blepharoplasty. In fact, it might worsen it because the actual problem is in the eyebrow. So you need a brow lift rather than an upper blepharoplasty, which will get your hooded eyebrow out of the way and allow your vision to be normal. But if you have excess skin on the upper eyelid, then you can do a blepharoplasty. If not, if it is only the brow, then you need a brow lift rather than an upper blepharoplasty.